Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, we prepare for summer. Dr. Josh Sharfstein speaks to Dr. Sancy Leachman, the chair of dermatology at the Oregon Health and Science University. Their topic is skin cancer, and specifically the war on melanoma. Let's listen.
Dr. Sancy Leachman, thank you so much for coming to talk to me now, just as the weather is getting warmer. How are you doing?
I'm doing well, Josh. Thanks for having me.
We get a lot of different material sent to us about the podcast, but we got something about the war on melanoma, and that led me to call you. So can you tell me, first of all, what is melanoma? Let's just get that clear for everybody listening. And then why a war on melanoma?
Right. Well, melanoma is the most risky, lethal skin cancer that we have. It's fairly common and it's very aggressive. It metastasizes and kills people at a very early stage, less than a millimeter thick sometimes. And that's one of the reasons it's so important to catch it early. Because if you catch it early, melanoma is the kind of cancer that you can just cut it out and you'll be done with it and you can move on with your life without any interruption, no decreased quality of life. But if you catch it late, after it's already started to metastasize, it's very, very difficult to treat. And mortality is about 50%, no matter what we throw at it. The idea of having a war on melanoma is to really go after it. Don't let this monster of a cancer get you late. Let's get it early.
Got it. Now, you have been working from your position as a chair of dermatology with the state of Oregon to declare war on melanoma. How many people die from melanoma in Oregon?
So it ranges every year, the people who die. So we have about between 150 and 200 people every year, year after year after year, that pass away from melanoma, which if you think about it being a cancer that you can spot yourself and that most people do, it's pretty sad that anybody die. We shouldn't have that much death year after year after year. And a lot of the people are young. Young people die of melanoma as well as older people.
So we want to prevent those deaths.
Absolutely.
And the dermatologists of Oregon and others have come together to declare war. So what does a war on melanoma look like?
Well, it's a full spectrum, all fronts war, where we're really trying to get the word out to absolutely everybody in the state. Two messages. First message is look at your skin. Just look at your skin. Come on, it's not hard. Look at your skin. And if you see something that looks funny, that looks unusual, that doesn't look like the rest, go and see a practitioner about it or find out, check and make sure it's not cancer. So it's an all fronts war that reaches out to the community, but it's also engaging all of the other people that are skin health professionals in the community, people who are massage therapists and hairdressers, tattoo artists, electrologists. All of those people are licensed. And so the state is helping us to reach to all of them and train them about how do you catch a melanoma? How do you know what it looks like? We have a curriculum for them. And they're helping the Oregon Health Authority, for example, is helping us to get to them so that they can help us screen. And then we also have a curriculum that's for primary care providers, because if you do see something and you need to get it checked, the PCPs need to know, be prepared to look for it too. And doctors, we only get about a week or 2 weeks of dermatology in medical school. So if you don't go into dermatology, you don't really have a lot of experience with melanoma. So we've got this whole program for the physicians that are going to see it as well. And we have technologies for the highest risk patients that need a lot more surveillance at the dermatology level. So I guess this war, when I say it's all fronts, I mean it is all fronts. It's to the community, it's to all the patients that are within the community, it's to the skin service providers, it's to the PCPs, and it's to the experts. And we really want to hit everybody and get those messages that I just talked about out.
Wow. Okay. So we've got a preventable cancer, and you want to engage the entire state as much as you can in identifying early melanoma so they can be treated before they kill. You said tattoo artists. So I'm going to go back to that. That triggered a part of my brain, which is most conversations about public health do not include the words tattoo artists. So as a dermatologist, have you been referred patients by tattoo artists in the state of Oregon?
Yeah, that's a great question. We actually do get people from tattoo artists because when you start to look at where you're going to put a tattoo, people who are very moly, you don't want to cover over the mole, because if you do, you won't be able to tell whether that mole has changed in a way that could be malignancy. And like I said, catching it as early as possible is really important. And if you've covered over it so you can't see it as well, then yeah, it could actually lead to something that's lethal that didn't need to be lethal. So we have been referred patients from tattoo artists. The other thing that's really cool, we were trying to figure out, okay, how do we actually get people to think about photoprotection as well? And one of the things we know is that tattoos fade when they are exposed to more UV light. And so that's kind of a byproduct of getting their tattoo to stay longer, is to avoid more sun. So we work with tattoo artists quite a bit.
Got it. So one of the big messages is see if you can spot a problem, or maybe your tattoo artist will spot the problem. Do you also have a big prevention component? You just mentioned avoiding the sun. What are you telling people about how to not even get that early melanoma?
Right. Obviously, that's even better than catching it early, is to prevent the whole thing. And so there's 3 elements to that. There's basically using photoprotection like sunscreens and photoprotective clothing, but there's also sun avoidance. So, going under shade structures when you're out, not going out at the time of day that's the worst in the middays, choosing to do activities early or late, and obviously screening your skin to make sure you don't see anything that's coming up. And those are the messages that we try for preventive health for melanoma.
What about tanning? People sometimes go out and tan at the beach on purpose, and Oregon has some beaches, but also people go, even in the wintertime, to tanning salons. How is that part of the war on melanoma?
Yeah, it's a really good question. People think that in Oregon, we shouldn't have a very high rate of melanoma because it's so rainy all the time, but that actually leads to sort of almost a photo deprivation of sun. People need some sun. And so it's a state with one of the highest numbers of tanning salons, because people have this feeling that it can help them with seasonal depression, which is not true, right? It doesn't. It's not that wavelength of light that helps. They have this feeling that it may harden their skin so that when they go on their beach vacation, because they're in a rainy climate, that maybe they'll be better off, but that's not true either. And so there's a lot of myths around, and some of the myths may be even driven by the marketing for tanning salons. So our main way of tackling that is to get the truth out there, is to really help educate. Education is the great equalizer. And so we try to help people understand that they're putting themselves in harm's way dangerously. Honestly, there's nothing that kills me worse than to have a young woman coming in the peak of their life. They've got young kids at home, and all of a sudden their tanning salon days come back to bite them and they get a melanoma. Once you've got a melanoma, it can be life-threatening, and you've got a whole different set of things to consider once that happens.
Got it. So you've got recognize them early, you've got sun avoidance and sun protection, and you've got the facts that tanning can cause melanoma and not believing the myths about tanning. So there's a lot that Oregon has in its mind. Let me ask you, what is the specific advice you tell someone who perhaps is listening to this podcast and is staring at a mole on their skin? What are the key things that you want them to know?
Yeah, the way that I talk to my patients about it, there's of course the ABCDEs of melanoma that you'll hear about, asymmetry and border irregularity and that sort of thing. But I try to boil it down a little more simply than that myself when I talk to a patient. And what I say is, look for a mole that you've already had that part of it is growing differently than the rest of the mole. If you see a part of your mole that is different than the rest, that means it's growing differently. And that growth difference may be because it's a cancer. So that causes border irregularity. That causes one side of it to look different than the other and all of that. So the first thing is if it's a pre-existing mole, if part of it starts to grow differently than the rest, that's a big problem. That's a red flag. The second one is if you get a new mole, because you can also have a melanoma develop in normal skin. If you get a new mole that looks different than all of the rest of your moles, then that's another red flag. So those are the two biggies. One that looks like part of it's growing differently than the rest, and the other is a new mole that looks different than the rest. So that difference, that ugly duckling effect, is a big one.
Got it. Sometimes it can seem that skin cancer concerns are focused on people with light skin, and dermatology has come under some criticism for not paying enough attention to people with darker skin pigmentation. How is your war on melanoma in Oregon making sure that nobody gets left behind?
Yeah, that's so important. The truth is that cutaneous melanoma on the normal skin of a body of a person, the lighter the skin type you have, the more at risk you are. So people who have more darkly pigmented skin are not at the same level of risk for that kind of melanoma. But there's other kinds of melanoma. There's melanoma that occurs on the palms and the soles and the nails. And people of color definitely can get their melanomas there. And they can be much worse melanomas. First of all, they're a different type of melanoma. And second of all, a lot of times, because it's in a person of color, they're not so worried about melanoma. So they don't even get it checked until it's so far along. And because of that, they're more life-threatening. So a person of color should never, ever not see a dermatologist if they've got something on their palms or their soles of their feet or their under their nails or anything on their body too. But it's the idea of doing that self-check that's really, really important. And we're all about education because we really believe that the most powerful thing we can do for people is to educate them on what I just said, right? So we've got a little mobile program going to the Latino community, to our tribal communities. And actually, the American Indians in Oregon, we're reaching out to 43 different tribes, and their rate of melanoma is remarkably high. It's way more than I would have expected. And so it's a very important point to bring up.
So lots of activity going on in Oregon. How will you know whether all this is working?
So I'm so glad you asked that question because that's what you want to know. You don't want to put all of this effort in and then not know, did it make any difference? And the way we're doing it, we've got a couple of ways. We're looking at a survey that we did before we started all of the campaign back in 2019. And we're going to do the survey again after the campaign. And we've done this survey not only in Oregon, but we also did it in Washington State and in Utah. And we didn't do the campaign in Washington State or Utah. So what we're really hoping is that we can show that all of the states got better. We're hoping that all of the states learned more and are doing more skin self-exams and all that, but that the state that got the campaign, which is Oregon, got better by a bigger margin, right? Did better than Washington and Utah to prove that it was the campaign that really, really was the difference. We also are looking at whether or not our rates of melanoma development and rates of melanoma death changed during that period of time too. And that we do in collaboration, again, like you said, with our state registry, our state cancer registry is helping us with that to figure that out.
Got it. Well, I know you have a great weapon in the war in all of the tattoo artists in Oregon.
It's true.
I really hope that this works. I really appreciate your efforts. And I really thank you for joining me on the podcast to talk about melanoma, because what you're talking about is relevant to every single one of our listeners. Thank you.
Thank you. I appreciate the opportunity to get the word out.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.